What happens to your blood sugar when the lights go out? In this special compilation, we've gathered our most eye-opening can't-miss moments about diabetes and sleep. We're unveiling the secrets your body's been trying to tell you. Ready to finally get the full picture of your nighttime health? Let's dive in. Number 1. Nocturia. Nocturia is a term that might not be commonly known, but its effects are palpably disruptive, especially for those with diabetes. It signifies an increased frequency of urination during the night. Elevated blood sugar levels in diabetics often lead to this condition, as the body attempts to expel excess glucose through urine. Consistently waking up during the night to visit the restroom not only disrupts one's sleep cycle, leading to fatigue and reduced daytime alertness, but it also serves as a significant indicator of one's blood sugar not being within the optimal range. For those seeking to manage this nighttime sign, 2 key strategies can be considered. Firstly, regulating and consistently monitoring blood sugar levels, and secondly, being mindful of fluid intake in the evening hours. However, if the issue persists, it's crucial to consult with a healthcare professional, as other factors might be contributing to nocturia. Number 2. Night sweats. Night sweats often manifest as excessive sweating during sleep, even if the room's temperature is cool. In the context of diabetes, these intense sweats can serve as an alarm bell for nocturnal hypoglycemia or low nighttime blood sugar levels. Several triggers can contribute to this, from certain medications and intensive insulin treatments to an imbalance in daily meals or rigorous evening exercise. Waking up drenched not only interrupts a good night's rest, but also indicates that the body's glucose has plummeted to concerning levels. To adeptly manage night sweats, it's crucial to consistently monitor blood sugar, especially in the evening. Recognizing and adjusting potential triggers can be instrumental. Furthermore, under the guidance of a healthcare professional, medication dosages might need revisiting. As a precaution, having a readily accessible glucose source, such as glucose tablets or juice bedside, can be life-saving during nocturnal glucose dips. Number 3. Restless Leg Syndrome, RLS. As we dive into this segment, please subscribe to this channel if you're finding this video helpful. Thank you. Restless Leg Syndrome, RLS, is a neurological condition characterized by an uncontrollable urge to move the legs, often accompanied by tingling, itching, or a crawling sensation. This discomfort can escalate during periods of inactivity, making it particularly troublesome during nighttime. For diabetics, there's an observed link between the prevalence of RLS and peripheral neuropathy, a common complication of chronic elevated blood sugar levels. Managing RLS in the context of diabetes involves a multifaceted approach. Firstly, maintaining optimal blood sugar levels can potentially reduce the onset of neuropathy and, by extension, RLS. Additionally, certain lifestyle changes, such as reducing caffeine and alcohol intake, can alleviate RLS symptoms. Regular moderate exercise has been shown to help, but overly strenuous activity might exacerbate the symptoms. For some, massaging the legs, applying warm or cool packs, or even practicing relaxation techniques like meditation can provide relief. Number 4. Sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep, leading to frequent awakenings. It's particularly concerning for diabetics, as the disrupted sleep and reduced oxygen levels can contribute to insulin resistance and poor blood sugar control. Sleep apnea itself can be a result of obesity, which is also a risk factor for type 2 diabetes. Managing sleep apnea often involves a mix of lifestyle changes and medical interventions. Weight loss can be particularly effective, as even a small reduction in weight can alleviate symptoms. For immediate relief, continuous positive airway pressure CPAP machines are commonly used to keep airways open during sleep. In terms of lifestyle changes, avoiding alcohol and sedatives, which can relax the airway muscles, can be beneficial. Side sleeping is also recommended over back sleeping to prevent airway blockage. Given the interconnectedness of sleep apnea and diabetes, effective management can lead to improved blood sugar levels and overall well-being. Number 5. Nighttime hypoglycemia. Nighttime hypoglycemia refers to low blood sugar levels that occur during sleep. For diabetics, it's a critical concern as it can go unnoticed, leading to potential complications. Symptoms might include night sweats, vivid dreams, or waking up with a headache. Extended periods of hypoglycemia can result in seizures or even unconsciousness. Managing nighttime hypoglycemia is central to the well-being of diabetics. Regular blood sugar monitoring, especially before bed, is essential. If levels are low, consuming a carbohydrate-rich snack can prevent a nocturnal dip. Adjusting the timing or dosage of insulin or other diabetic medications under a doctor's guidance may also be necessary. To quickly counteract nocturnal lows, it's advisable to have a fast-acting glucose source, such as glucose gel or tablets, within arm's reach of the bed. Educating friends or family about the signs of severe hypoglycemia and how to administer emergency glucose or glucagon injections can also be life-saving. Number 6. Nighttime frequent thirst. Nighttime frequent thirst is a telltale sign for many diabetics, particularly when blood sugar levels are elevated. High glucose concentrations in the bloodstream draw water from cells, leading the kidneys to produce more urine to flush out the excess sugar. This cycle results in increased thirst and frequent urination, even during the night, potentially disrupting sleep. Effective management of this symptom is intertwined with overall diabetes control. Keeping blood sugar levels in check is paramount. Monitoring glucose levels and adjusting medication or insulin dosages accordingly, under a healthcare provider's supervision, is essential. Hydration is crucial, but to mitigate nighttime disruptions, try to balance fluid intake throughout the day rather than consuming large amounts in the evening. Additionally, cutting down on caffeine and alcohol can help, as both can act as diuretics, increasing urine output. Recognizing and addressing nighttime thirst is vital, as it's not only a sign of elevated blood sugar but also a potential disruptor of restorative sleep. Number 7. Nighttime cramps. Nighttime cramps, characterized by sudden painful muscle contractions, predominantly in the legs, can be distressing for diabetics. These cramps can arise due to high or low blood sugar levels, reduced circulation, or diabetic neuropathy, a nerve disorder resulting from prolonged elevated blood sugars. To manage and reduce the occurrence of nighttime cramps, maintaining stable blood sugar levels is the foundational step. Regular monitoring and adhering to prescribed medication regimens can help keep glucose in check. Additionally, gentle stretching exercises before bedtime, particularly for the calf muscles, can alleviate tension and reduce the risk of cramps. Keeping hydrated, ensuring a balanced intake of minerals like magnesium and potassium, and wearing supportive footwear can also play a preventive role. Warm baths or using heating pads can provide relief from cramps. If nighttime cramps persist or intensify, it's essential to consult a healthcare provider to explore underlying causes and receive appropriate treatment recommendations. Number 8. Heartburn and gastroparesis. Experiencing heartburn or the symptoms of gastroparesis during the night can be a subtle indication of unmanaged diabetes. High blood sugar levels over time can damage the vagus nerve, which controls the movement of food through the digestive tract. When this nerve is impaired, the stomach can't empty its contents effectively, leading to gastroparesis. Symptoms include heartburn, bloating, and even nausea. Especially at night, when the body is in a horizontal position, there's a greater chance for acid reflux, causing heartburn. Beyond discomfort, prolonged gastroparesis can cause severe complications like unpredictable blood sugar spikes and bacterial overgrowth from undigested food. Recognizing these nighttime signs is crucial. They signal not just the immediate discomfort of disrupted sleep, but also the potential presence of nerve damage, underscoring the necessity of optimal diabetes management and timely medical intervention. Number 9. Peripheral neuropathy. Peripheral neuropathy, a common complication of diabetes, arises due to prolonged high blood sugar levels which damage nerve fibers, primarily affecting the legs and feet. At night, the symptoms of peripheral neuropathy can become pronounced and particularly bothersome. Individuals may experience tingling, burning, sharp pains, or even a complete lack of sensation. The absence of distractions at night makes these sensations more noticeable, and they can disrupt sleep significantly. Ignoring these symptoms is risky because, over time, diminished sensation can lead to unnoticed injuries, infections, or ulcers, which can have severe complications in diabetics due to reduced healing capabilities. Recognizing and addressing peripheral neuropathy as a nighttime diabetes sign is essential not only for comfort and sleep quality but also as a preventative measure against more serious complications that can arise from untreated neuropathic symptoms. Number 10. Worsening vision. Worsening vision at nighttime can be a significant and concerning sign of diabetes. Fluctuations in blood sugar levels can cause the lens of the eye to swell, altering its shape and affecting its ability to focus, leading to blurry vision. This symptom is particularly evident during nighttime when the contrast between darkness and artificial lights can exacerbate vision difficulties. Poor night vision or difficulty in adapting to different light levels might signify the onset of diabetic retinopathy, a condition where high blood sugar damages the blood vessels in the retina. Ignoring these visual disturbances can have dire consequences, as diabetic retinopathy can lead to permanent blindness if left untreated. Addressing worsening night vision promptly is not just crucial for safety and daily function, but it's also vital for detecting, managing, and possibly preventing severe diabetes-related complications. Number 11. Feeling hungry. Nighttime hunger that's insistent and unusual can be a revealing symptom of diabetes. When one has diabetes, the body either doesn't produce enough insulin or cannot effectively use the insulin it does produce. As a result, glucose from the bloodstream can't efficiently enter the cells to be used as energy. This lack of glucose in the cells sends a signal to the brain that the body needs more fuel, causing a sensation of hunger. So, even if you've had a proper dinner, you might find yourself feeling unusually hungry at night. Ignoring this symptom can lead to overeating and weight gain, further complicating diabetes management. Moreover, consistent and unwarranted hunger pangs, especially during nighttime, can indicate that blood sugar levels are not well regulated, underscoring the importance of recognizing this sign and seeking timely medical advice. Number 12. Dry mouth. Dry mouth or xerostomia at night is more than just an uncomfortable symptom, it can be a telling sign of uncontrolled diabetes. Elevated blood sugar levels can cause the body to pull fluids from tissues, including salivary glands, leading to reduced saliva production. As a result, individuals might experience a persistent dry mouth, especially noticeable during nighttime when saliva production naturally decreases. Consistent dry mouth not only disrupts sleep but can also pave the way for dental problems. Saliva plays a crucial role in neutralizing acids and cleansing the mouth, so a reduction can increase the risk of tooth decay, gum disease, and other oral infections. Furthermore, dry mouth might be a symptom of undiagnosed or poorly managed diabetes, indicating that blood sugar levels are not within the target range. Recognizing and addressing this symptom is essential for both oral health and optimal diabetes management. Number 13. Difficulty sleeping. Difficulty sleeping or frequent nighttime awakenings can be linked to diabetes-related issues. High blood sugar levels often result in the need for frequent urination during the night, leading to disrupted sleep. Additionally, elevated glucose can cause restlessness or an unusually heightened state of energy, preventing one from settling down comfortably. What's more, persistent sleep disturbances can exacerbate the problem. Lack of proper sleep can contribute to stress and hormonal imbalances, which in turn can further elevate blood sugar levels. It becomes a cyclical problem. Thus, consistently poor sleep or changes in sleep patterns should not be overlooked, as they might be indicative of uncontrolled diabetes or its onset. Ensuring adequate restful sleep is essential for overall well-being and effective diabetes management. Number 14. Itchy skin. Itchy skin, particularly prevalent during nighttime, can be a discrete warning sign of diabetes. Elevated blood sugar levels can lead to dehydration by prompting the body to expel excess glucose through urination. This frequent urination can cause the body to lose more moisture, leading to dry and itchy skin. Furthermore, diabetes can cause poor blood circulation, which can also contribute to skin dryness and itchiness. Additionally, persistent high sugar levels can make one more susceptible to skin infections caused by yeast or bacteria, resulting in itching. At night, with fewer distractions, individuals might become more aware of these sensations. Continuously ignoring this symptom may lead to complications, such as skin infections or conditions, and untreated cuts or scratches might heal slower in diabetics. Recognizing and addressing itchy skin can be a step toward uncovering undiagnosed diabetes or improving blood sugar management. Nighttime can unveil subtle diabetes symptoms that often go unnoticed during daytime hours. These signs should never be ignored as they offer crucial clues about your overall health. Early detection can make all the difference in effectively managing diabetes and improving your quality of life. If you're experiencing any of these symptoms, consult a healthcare provider for proper diagnosis and treatment. You might also want to check out this video for more crucial diabetes signs and symptoms. And please subscribe to this channel if you found this video helpful. Thank you for watching.